The following segment is sponsored by Northern Nevada Health System.
We are here with Sedona Shonnard, a physical therapist with Northern Nevada Medical Center, talking about stroke. And Sedona, first of all, thank you for being here. First question is, what are some signs that someone might be having a stroke?
That's a great question.
Yeah.
We use this acronym called BFAST. It stands for B, balance, if you feel like there's a sudden change in your balance. Eyes, if you feel like you all of a sudden have some blurry vision or one-sided is blurry, sudden changes in vision. F is for face, if you feel like you either feel like you have one side of your face drooping or you see somebody have one side of the face drooping. A is for arms. You can ask somebody to put their arms out, close their eyes, and you're going to see this situation where one arm goes down. The S stands for speech. If there's a sudden speech blurring, or you're having like somebody's all of a sudden saying blah, 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 and they think that they're saying something that makes sense, that's a big sign. And then T is for time. It's super important if you do see these signs to get to the hospital right away. This is a 911 call. It is not a, well, let's see what happens.
So after a stroke, how does physical therapy help?
Yeah, absolutely. So physical therapy is really important in getting what we call neuroplasticity. The neurons that are affected after a stroke are not able to regenerate. So neuroplasticity is building connections between existing neurons to be able to do some of the similar activities that we did before. So like gait training, balance, being able to, get off of the bed, get in and out of bed, go into the restroom, that kind of thing.
And so a stroke patient, what can they do to benefit the most from coming here and getting their physical therapy?
Absolutely. I would say moving is top one.
Movement
right?
is medicine.
Movement, motion is lotion. You'll hear a lot of PTs say that. But I would say continuing to move, and even when you're not with your therapist, you're still working on your affected side. You're trying to use that side as much as possible. Also, I would say nutrition and hydration are very important as well. Staying on top of being hydrated and getting a good balanced diet.
And then, so of the symptoms you just described earlier,
Yeah.
which symptoms will improve with physical therapy typically?
Yeah. Typically, you're going to see great improvement after 2 to 3 weeks of that initial stroke. And you will see improvements in all areas. Physical therapy is pretty great at being able to return somebody to as high a function as possible, depending on how large the stroke is.
All right. And Sedona, thank you very much.
Absolutely.
And for more on all of this, go to our website, foxreno.com.